I'll talk in English, sorry, but it's not good. But speaking Spanish, it's worse. And if I talk in Portugal, you feel like me in the morning when I hear about Catalan. So, my name is Maria Inês Marques, and I'm a veterinarian and also family physician resident at USF Renal Chance in Lisbon, and also one of the founding members of the One Health study group of the Portuguese Association of General Practice. Ricardo Assunção is associate professional at Egas Muniz School Health of Science, a Portuguese university in the context of health science. He's also a researcher in the context of public health, and his participation in national and international research projects, and it also with several scientific papers in the field. So, thank you, Dr. Jordi, for the invitation to be here, and I will share our work in Portugal in this field. So, probably all together in this room, what we want, a world better able to prevent, to predict, to detect and to respond to health threats and improve the health of humans, animals and plants, and environmental when contributing to sustainable development. So, One Health in primary care, why is so important? It's because we need to target primary care practitioners. It's important primary care will be the first line of response for people seeking care when environmental change, destructions and pollution intensify intersection risks such as disasters, extreme temperatures, zoonotic disease and food insecurity. So, our presentations will focus the key opportunities that we consider important for intervention in this field, and we will talk about the raising awareness and increase understanding, the communication, the health promotion, social and behavior changes, the promoting sustainable development, the emerging health challenge, the cooperation in science, the policy, advocacy, and the climate change. Yes, it's a lot. So, the One Health Study Group of the Portuguese Association of General Practice creates in January 2024, and this is our specific aims of the group. Yes, we are ambitious. Some of them we have already done. And what about raising awareness and increased understanding? We think about the concept of planetary health highlights the importance of recognition, the link between the human health and the global environment, promoting significant changes in human activities, including the healthcare. One of the essential barriers that needs to be overcome in Portugal, we think it's the lack of the awareness among citizens and the health sector probably in the family physician, in primary care. And its approach is the privileged phase that doctors have as promoters of changes in community. So, making this concept known is the key to promoting environment conservation from a broad perspective and planetary health as a whole. So, in the communication in health literacy, we all need to act in the community, the health sector, and education. In the health sector, the Egas Muniz School of Health of Science organizes a One Health Symposium to celebrate the One Health Day, and it's an early-based symposium that gathers different stakeholders related with One Health, inviting international speakers to discussion hot topics in context of One Health. The One Health Study Group has the same scheme. We have one early-based annual congress, and in this year we also have the congress called Encontro do Outono, that is organized by all the study groups and Association of Portuguese of General Practice. In October we are in the 10th meeting. GRASP is the respiratory disease study group of the APMGF, and we will talk about antimicrobial resistance and the impact of respiratory diseases of antimicrobial use. So, in education, One Health can provide a conceptual basis for a curriculum that can teach young people how to look beyond immediate results and to ask complex questions while seeking a deeper understanding of integrated problem solving that preserves the health of the entire system. The role of this intervention is increasing young people's knowledge, and their attitudes and practice has still been studied systematically, although it's already been known in higher education students. So in Portugal, we want to achieve the school-age children and young people in the early school. Higher education students, and indeed in postgraduate education. In Portugal, we have some master's degrees, doctoral, and other qualifications like graduate diplomas, and in 2025 we have the first doctoral degrees in planetary health. So this is one project that I was pleased to be part of. That the infectious disease department of São João University of Hospital Center in Portugal, created a One Health group and founded a One Health group and created an interventional project called Education for One Health, from hospital to school. And the main objective of this intervention project is to familiarize the Portuguese community with the One Health concept, as well as the empowerment stakeholders involved to integrate their approach into their daily lives in order to foster critical thinking and apply interdisciplinary in the world. So the aim is for the school community to be a vehicle for perpetuating and disseminating of the One Health global health strategy in the rest of society. It is based on the pilot project. In the medium term, they intend to extend the scope of the initiative to the school world in Portugal, encompassing all levels of undergraduate education. So, in this way, thoughts to be continuous training and capacity building of school professors, we aim to guarantee the complete autonomy education establishing the training of the students. This autonomy will be on partnership and collaboration between all of the parties involved in the project. So, I was pleased to be the collaborator with this project, and I brought it to Lisbon. So this is me in the school, and look out the happy faces of the students in this project. We have the sessions that is adapted to all ages, in the 3-4 ages about and at secondary education. So, talk about health promotion, social and behavior changes. So, given the role of family physician in health promotion and disease prevention, professionals in the fields are in the privileged position to advise patients on daily choices and fundamental changes that can be made for benefit, both of them, health and the health of the environment. So, in this sense, the co-benefit approach has repeatedly highlighted as the most effective way. Sorry, yes. Quickly. So, very quickly. One example on promoting sustainable development is the transition, the food systems, and it will well establish the exert and increase impact on the environment, and is amplified over time due to growth of the human population, changes in food consumption patterns, and intensify of production systems. So it is important to think about alternatives like produce and eat differently, and we need to making healthier and sustainable food choices. So Portugal origins this project called the Insect Terra that promotes or identify alternative protein sources in insects that could be healthy and sustainable. In Portugal, we have the action plan to combat the resistance antimicrobial, and the PPC is the program of control the infections and the resistance, created also a pocket guide to antibiotic therapy in outpatient setting to improve the antimicrobial stewardship. So zoonotic diseases called by zoonotic spillover. So cooperation in science and what we do in Portugal. we will we work with the Portuguese Council of Health and Environment, and we are drawing in this year recommendations about environmental sustainability standards in the use of inhalers. And the Egas Muniz School of Health Science have 3 projects. The insectary that considers insects in the food chain as alternative source of protein for feed, food, but also in context of circular economy regarding food waste. We have the Embalagem do Futuro, like focusing the development of different food package alternatives, and the Best Cost project is developing a new methodologic framework to understand the social and health costs of air and noise pollution. Hopefully, in 2025, we will be the first online course on planetary health for primary care with association out of with the Faculty of Medicine in Lisbon.
We need to move forward because we need to have still 2
Yes.
speakers and we have to need a time.
Bye. Muchas gracias.
Thank you very much.